Hi, this is Dr. Simon-Cereijido. Today we are going to talk about children with hearing loss. This is the lecture 7.A. In the United States, we have laws aiming to identify and help babies who are born with hearing loss. Early detection and intervention represents a paradigm shift that has occurred in the speech and hearing profession. The term paradigm shift refers to a radical change in thinking leading to new approaches. Most states now require newborn hearing screening as part of an early detection of hearing impairment program. And these programs provide two critical improvements. Children are now identified at birth as opposed to 2 or 3 years of age, and intervention can begin within critical windows of opportunity in the first few months of life. In 2000, Congress reauthorized the grants of newborn infant hearing screening and intervention. It has funds for screening and evaluation of all newborns, for coordinated intervention, rehabilitation services, and research. I would like you to review your notes about the hearing mechanism and basic audiology concepts. There is a link to a website that has excellent information in the Moodle page. The reported prevalence of hearing loss among children varies significantly depending on the criteria used to identify the loss. 4 of every 1,000 children have hearing loss, one of the most common disabilities. The prevalence increases with age to 20% of those over age 12. 3 out of 4 children will have at least one experience of otitis media associated with mild hearing loss. There may be co-occurrent conditions such as intellectual disability, learning disability, visual impairment, and other disorders. And on this table from your book, you can take a look at the co-occurrent condition. Note that children with associated impairments, in addition to hearing loss, are more likely to use sign language. Approximately 21% of children with hearing loss use sign language as a major method of communication. Approximately 40% of children with hearing loss have associated disabilities. So, what is pediatric hearing loss? Hearing loss refers to a condition in which a child or adolescent is unable to detect or distinguish the range of sounds normally available to the human ear. Hearing loss affects the outer ear or the inner ear. Auditory processing disorders are hearing losses resulting from damage to the processing centers of the brain. Hearing loss among children is highly variable. It depends on the location of the damage, whether it affects one or both ears, whether we are going to have bilateral or unilateral hearing loss, and the extent to which hearing acuity is impacting depends on the timing. And the hearing loss may be congenital, prelingual, before learning to talk, or postlingual, after learning to talk. Hearing loss in children and adolescents is typically classified according to its etiology, its manifestation and impact, and its severity also. We may have developmental losses or acquired losses. Prelingual, like we said, is before language, and postlingual after language is acquired. The type of loss, it identifies the auditory structures that are affected. In classifying the hearing loss of a given individual, experts consider all these sources of information. Some children with hearing loss experience loss of hearing acuity, referring to the precision of hearing at different levels of loudness. More problematic than a loss in acuity is a decrease in auditory comprehension of spoken language and speech perception, which can accompany hearing loss. Hearing loss is also classified according to its severity, using the decibel system. And remember that the decibels are standard units of sound intensity, representing the differences in loudness available to human hearing, from the threshold of sound at 0 dB, the drop of a pin, to the threshold of pain between 120 dB and 140 dB, similar to a fire alarm close to your ear. Audiologists determine the severity of a hearing loss with an audiogram. When sound is not conducted efficiently through the outer or middle ear, the result is an attenuating or reduction of the sound heard. Children who have a conductive hearing loss, whether it is temporary or persistent, experience this attenuation of loudness. Children frequently experience conductive hearing loss, which in many cases can be reversed. Because it is unwise to clean the ear canal with cotton swabs, and because many children have narrow ear canals, wax buildup can occur frequently and also block sound transmission. Another cause of temporary conductive hearing loss is otitis media. Sensorineural hearing loss is the most common type of hearing loss. It results from damage to the cochlea or the auditory nerve that travels from the cochlea to the brain. Even though sensorineural disorders are thought of as a decrease in overall loudness, they are also associated with a decrease in speech perception and the decreased ability to distinguish speech from background noises. Most often, sensorineural hearing loss is present at birth as a congenital hearing loss. Known causes of deafness are genetics, pregnancy-related illnesses, and post-birth disease or injury. A mixed hearing loss occurs when there's both conductive and sensorineural loss. A mixed hearing loss typically includes a permanent reduction of sound as well as additional temporary loss of hearing from the conductive component. Assessment for hearing loss in the pediatric population requires a multi-tiered approach. That means several professionals get involved. The process includes a referral, a screening. If the screening fails, there's a comprehensive audiological evaluation, and if there is a loss, there has to be a hearing aid evaluation. We'll stop here. We continue in the next slide. Please take notes and write down your questions. Thanks so much.